Next on Arizona 360, the head of the nation's ports and borders visits Arizona.
What I'm here to see is what additional resources they need to be even more effective.
The latest vision for a church the city wants to protect.
Demolition is no longer going to be used as a threat.
And as Arizona grows, a population not prospering.
Children are still not a priority.
Hi, and welcome to Arizona 360. I'm Vanessa Barchfield, filling in for Lorraine Rivera. Thanks for joining us. The Trump administration has less than a month to reunite migrant children separated from their parents at the border. This week, a federal judge set a deadline of 30 days or 2 weeks if the child is under 5. That ruling came down a day before the Commissioner for Customs and Border Protection, the agency that had been tasked with enforcing the president's zero-tolerance policy, toured facilities in southern Arizona. Nancy Montoya was there for his visit.
Good to see you again. How you been? Good. All right.
As CBP Commissioner Kevin McAleenan visited the Mariposa port of entry in Nogales, it was made clear by his staff that he would take no questions about family separations. But in a memo viewed by Arizona public media, the CBP Commissioner told his agents the zero-tolerance policy would no longer be enforced by CBP, telling media in Texas that prosecution referrals to the U.S. Attorney's Office would be suspended immediately. Commissioner McAleenan oversees more than 60,000 employees and a budget that exceeds $13 billion. Today, he wanted to see what a $220 million expansion of the Mariposa port of entry looked like. The expansion made this the fourth busiest port of entry in the Southwest. According to U.S. Customs, this makes Mariposa the single most efficient state-of-the-art port in the nation.
I'm very happy with the leadership and the effort of our officers, their training, their intensity. I think it's tremendous. And what I'm here to see is what additional resources they need to be even more effective.
Any of them would tell you they need more manpower.
They need more officers, 100%. That's my top priority as commissioner for the whole organization, is hiring and increasing our officers.
And that's welcome news. But then again, that's what several commissioners before him have vowed to do. Now, according to their own data, the most frequent complaint lodged against Customs and Border Protection at the border is long wait times and closed lanes. The commercial end, processing those huge semis going back and forth at the border, has been dramatically improved, saving trucking companies millions of dollars and hours of waiting time. But for tourists and those crossing the border by foot or car, depending on the time of day, it can be miserable and time-consuming. And no one knows that better than Guadalupe Ramirez, the acting director of field operations for the port.
I'm not telling you anything you don't already know. What's the solution to this? How is this commissioner going to help you do that?
Basically, we have a new recruiting program where basically they have tasked every recruiter nationwide to recruit for Arizona. So it doesn't matter where the recruitment is taking place, the primary focus is on Arizona and getting us staffed.
And recruiters all over the country are singing Arizona's praises, like weather, cost of living, and the university. But there are other incentives.
If you join Men and Women in Blue and you come to Arizona, you qualify for an incentive, which is additional bonus pay for coming here. And again, in a very unique agency. As I said before, we don't respond to a crime. We process people and goods. We process legitimate travelers and merchandise. We are the trade police.
While all that is true, customs officials are also the first contact a migrant seeking asylum at a port of entry has with the U.S. Border Patrol, the men and women in green, and Customs, the men and women in blue, are often vilified for separating families and the treatment of immigrants at the border. There is a price to pay for working for Customs and Border Protection.
How do you keep morale up?
Well, I think you're right. I think, both us and our brothers and sisters in green, it's disheartening when you hear people talk about the agents, and the officers themselves, just because we wear a uniform and a gun and a badge doesn't mean that we're not human and we don't have a heart. And if they knew everything that our officers and the Border Patrol agents do for the children that we detain, our own officers, out of their own pocket will bring them toys and clothing and food. And, like I said, just because we have a gun and a badge doesn't mean we don't have a heart. And, we have to take care of these children while they're in our custody. We are part of the process. They arrive here, and our job is to process them. And then we have to wait for a space to be found for them. And once it's found and they take off, then we bring the next group in and process them. So, we're not a detention facility.
But the Southwest Key Center in Tucson is. Now, when word reached community activists that First Lady Melania Trump was planning a visit to Tucson, protesters quickly activated and demonstrated at the only known location in Tucson, other than Border Patrol, where immigrant children are being detained. The Southwest Key Center can house up to 300 children. It is part of a $1 billion nonprofit with 5,000 employees. Protesters were hopeful the First Lady would visit Southwest Key. Instead, Melania Trump never left federal property, venturing only to an on-base Border Patrol facility. There, she met briefly with CBP Commissioner Kevin McAleenan and Tucson Sector Chief Rudolfo Karish. She was on the ground for about an hour, then left for a stop in Phoenix. Now, while protesters never saw the First Lady, they still got their message across.
Finding a new purpose for a renowned church in Tucson is an ongoing challenge for both developers and its neighbors. Months after nuns at the Benedictine Monastery sold the property and moved, the developers and city have been going back and forth over how to proceed. When we first discussed this issue in April, developer Ross Rolney proposed 7-story apartments adjacent to the monastery. Some took issue with the height. This week, he came back with a revised plan. Shortly before that, we spoke to Councilman Steve Kozachik about ongoing efforts to get the monastery designated as a historic landmark. Why did the City Council decide to go ahead with pursuing a historic landmark status for the monastery?
It was a very intentional move to send the message to Ross Rolney, the developer, that we are absolutely on board with talking about context and massing in the development, but demolition is no longer going to be used as a threat. And so we're taking that off the table. City Council, the city, is moving forward with the historic landmark designation. And quite honestly, I've spoken to the nuns, and they said that when they put the building and the site on the National Register of Historic Places, that was back in 1994, it was their understanding that that provided the protection to the building that the HL designation will. So we are simply carrying through on what the nuns had felt had already been achieved. We're already amassing documents to go through that whole process. It'll be a very public process, though, and so Ross will have a chance to speak at public meetings, public hearings before it's finalized. And eventually it'll come to the Mayor and Council for a vote.
And is the city setting itself up for a lawsuit in this case? In
order for Ross to bring a 207 lawsuit indicating diminution of value, he would have to demonstrate that there's a financial loss of earning capacity by us doing this. I have looked at studies, and we'll present the studies if it gets to that demonstrate that once you put the stability of an historic landmark zoning on a property, it actually increases value because developers then know that building is there, it's stable, the community values it, it's not coming down, and they can move forward with their development on the outskirts of it in an appropriate manner. So I hope it doesn't get to that, and I've spoken to Ross, and Ross and I are not combatants. I've met with him as recently as last week, and we had a conversation about what's appropriate on the site, what's not. He's going to have a meeting coming forward on the 28th where he and the development team is going to, again, present to the community what they want to do with the site.
Good evening. Thank you all for being here. We are very serious about preservation in our office. It's what we do. It's almost all of what we do. No one's ever thought of doing demolition on this site. Let's put that rumor to rest. We'll show you some height changes and some issues that we think we've dealt with effectively, but you're not going to see any new designs. This is where we were 3 months ago, so that's what we're looking at now. The taller, the mid-rise building on the north and south steps down from 6 stories to 3 stories. This is a view from Country Club looking southeast. We've got a lot to show for it, but we've got a long way to go to get this project to be good and successful and embraced by the community.
Everybody's going to have to give a little. You know, Ross has given some. You mentioned the neighbors. They're going to give some in terms of the ultimate massing of what's going on around there. The first pitch, though, was completely out of scale, and that's when you and I spoke the first time.
Another major project in your district is, of course, the 20-story tower that City Council just voted on at Speedway and Campbell. You've been supportive of that project. Why is that?
We've been looking at this thing for 15 years. I met with Joel Valdez in his office about it probably 9 or 10 years ago. The Campbell Speedway project has not been rushed to. They've talked to the public for 3 or 4 years on that. It's good architecture. It's on 2 major arterials. It's buffered between the project and the neighborhood by the hospital and some other commercial development to the west, and the universities across the street on the south and the southwest. So it's a completely different context, and that's what the whole conversation about the monastery has been. Context, what's appropriate in the context of that site. Height axiomatically is not bad. You know, once you go vertical, it's not axiomatically a problem. 20 stories in one location versus 7 stories in another, and you get 2 different answers. It's not just the height that we're talking about, it's how it sits on the space and what's around it. So context matters.
Thank you so much for coming in.
Sure, you bet.
Most of Arizona gets its drinking water from underground aquifers or rivers. A lack of snowmelt or rain can threaten those supplies. To solve a problem that communities around the world face, researchers and companies in Arizona are working to find new ways to make drinking water, sometimes out of thin air. Andrea Achille is a professor at the University of Arizona's West Center, a research site off I-10 focused on water and wastewater treatment technologies. He says the work being done there to find new sources of potable water is fundamental because the future where we have less water, it's already here.
I think the southwest part of the United States is pretty much out of riparian habitats, out of natural waters. So if you see in California, for example, they're looking for seawater desal as well as potable water reuse. Here inland as well, we are looking for potable water reuse. And one great opportunity is to use the wastewater.
Achille says people's attitudes are changing quickly about using reclaimed water, which he says got the rather unfortunate and inaccurate nickname toilet to tap.
Toilet to tap is a term that should not be used because it's exactly what we want to avoid, you know, from the toilet to the tap. We are treating the water very, very well, and technology-wise, I think there is no reason to not drink reclaimed water.
His research focuses on improving technologies for treating reclaimed water and desalinating seawater, 2 technologies already in use around the world. And he says he sees a lot of promise in other technologies as well.
We could perhaps use water from the atmosphere.
One company that's developed that technology is based here in Arizona. We went to the Scottsdale headquarters of Zero Mass Water, which went to market with its source panels last year.
So this is a source hydro panel. It's using solar thermal and solar PV to extract the water vapor in the air into a very adsorbent material. So right below this top panel is where we're converting that water vapor into liquid water. And so what you end up with is very pure water, like distilled. So in our reservoir, in every panel, there's 30 liters of storage. We are storing water and mineralizing it with magnesium and calcium. That water is very simply delivered right to a tap. We can just put the little tube right through the walls, no interaction with existing plumbing, and it goes right to a dispenser, like here, straight from the panel.
She says CEO Cody Friesen, a professor at Arizona State University, wanted to solve one big problem.
All of us in some way experience water stress. So for some people, it's as inconvenient as having to go buy bottled water from a grocery store. For the rest of us, it can be, very life-altering. So people who struggle during droughts, people who are facing water contamination, and all sorts of access issues exist all over the world.
In working to improve access, one goal at Zero Mess Water was to not use any existing infrastructure. So instead, they looked to the sun.
So with solar, we're able to completely reduce the CO2 footprint of purifying drinking water, and at the same time make it something that people can have all over the world.
Researcher Andrea Achilli says making water out of air is energy intensive. So it works best where there's a lot of sun, but that creates other limitations.
It happens that, especially in the United States, we need water where the arid Southwest, where we need water, there is not that much water in the atmosphere, so the humidity is pretty low. So in that case, we need more energy to harvest that water. So that's a limitation. But we do have a lot of sun, which is good for the process.
Of course, humidity plays a role, but the access to sun that we have and the advanced efficiency of the technology makes it so that even in here, the arid Arizona desert, we are still making drinking water.
Zero Mess Water has been around since 2014, and they've grown quickly, operating now in 5 continents and 12 countries. Fitzgerald says they're working with aid organizations like USAID to install panels at places that need them around the world, including at refugee camps in Lebanon. And since late last year, the hydro panels have been on sale in the U.S.
Every panel is $2,000 with about an estimated $500 installation cost. Every hydro panel makes an average of 3 to 5 liters of water per day. So we start our standard array at 2 hydro panels. That's about a case of water per day.
The company is targeting customers all over who drink bottled water.
Bottled water being the most wasteful and potentially harmful of all drinking water that you could choose. And so, if you're buying drinking water through bottled water for your family, it's going to pay back in about 2 to 3 years. And it's a really great alternative option without any of the carbon footprint, any of the water footprint it takes to get that to you.
The U of A's Andrea Achilli says Zero Mess Water is one early example of how our water sources will look quite different in the future than they do today.
There is potential for what we call a tailored water, for fit-for-purpose water. So we will treat the water to be safe, not necessarily potable. It will be cheaper, and then we treat a little bit to very high quality standard to be drinkable.
He says that future is still a way off, though, and it's not just a question of technology.
So the paradigm now is like there is a centralized water treatment facility. We distribute the water to the houses. It's just one source, and then the wastewater goes away. So it can be that we have basically it's decentralized and more local treatments that will allow different sources at the house. So it's going to take some time.
When it comes to child well-being, Arizona ranks 45th out of all 50 states on the latest Kids Count report, released this week by the Annie E. Casey Foundation. The annual report collects federal, state, and local data about education, health, poverty, and family and community factors. At a time of economic growth in Arizona, we focused on the issue of poverty. The report says nearly a quarter of children live in poverty in the state, above the national rate of 19%. It also found 23% of Arizona children live in high poverty areas, compared to 13% at the national level. We discussed this with Michelle Crow of Arizona Children's Action Alliance.
The nice thing about this Kids Count data book is that it measures child well-being across the nation in each of the 50 states on 16 different indicators. And addressing any and improving any one of those 16 indicators affects each other and helps lower child poverty.
How is this high rate of child poverty actually playing out in kids' lives? Like, what does that look like tangibly?
A family, what that looks like is it's urgent, right? It's a child, and that child is hungry, and that child has to go to school that day and take a test that's going to determine whether they can pass on to fourth grade or not, for example. It's them not understanding necessarily the circumstances that mean they suddenly have to move again, or it's parents that are, just landed a brand new job, but are recognizing that their choices are limited in terms of where they can place a young child in a safe, appropriate, and quality child care center. And then it's the heartbreaking conversation that sometimes our child care providers have to have with families that say, I'm sorry, we don't accept DES subsidies anymore because the rate at which they're being funded at this point, we can't serve that population. And so what's happening is we're having less and less opportunities for families to move ahead and for children to fulfill their ultimate potential.
And what needs to happen to really bring families out of poverty?
Public policies need to be developed to create a structure of support that will remove barriers that are preventing families from succeeding, but there's also a structure of support that allows families to access some of the needed pieces, if you will. And whether those pieces are, I need childcare, or I need a job training program, or whether I need health insurance, putting the pieces together and making sure that we can employ these strategies with families.
Because the poverty rate isn't tracking sort of economic development in the state, what does that tell us about who is prospering?
Well, we are seeing positive economic indicators, and that is good. I will tell you that Children's Action Alliance, we are an independent voice for children up at the state capitol, and we established ourselves about 30 years ago because we recognize that while there's a lot of people up at that state capitol speaking on behalf of their interests, children were not up at the state capitol. They don't have the ability to speak on behalf of their interests. So it's really incumbent upon us. So while I'm not an economist and I can answer your question precisely, I can tell you that children are still not a priority. Probably one of the deeper frustrations for me is not that there's a lack of funding or that there's a lack of understanding or that there's a lack of even agreement on what to do about this issue. There's just a lack of urgency to address it. And so I think considering that this is an election year and many people are up for re-election and many people are asking for people's votes, I would ask people to engage in that process and not only ask the candidates questions about these issues, but also try to get a sense of how much they would prioritize the issue and how much they're willing to really develop solutions to change it. Because I think the worst case scenario is that we could be meeting and having this conversation when we put out the 2019 Kids Care Data Book and still not see the needle move on this issue.
Thank you so much for coming in.
Let me go ask the doc real quick.
In rural communities, access to adequate health care can be difficult. This month, it got harder for those living in the town of Florence, where the hospital closed down for financial reasons. Dr. Daniel Dirksen oversees the Center for Rural Health at the University of Arizona and understands the challenges rural areas present for healthcare providers and patients.
Across the country, there's been 85 rural hospital closures since 2010, so we're not the only state that has had some trouble with rural hospital closures. Many of the rural hospitals, both in our state and other states, are really very close to negative margins, and so...
Financial margins.
Right, so they depend very much on Medicare and Medicaid for coverage, but also paying for their health services. And if they have to absorb a lot of uncompensated care, or what's called charity care, they often have difficulty staying open because their finances won't support their operations. In Arizona, I'd say our most vulnerable hospitals are the smaller hospitals. These are the ones with a federal designation of critical access hospital. They're the ones that are 25 beds or less, or 35 miles or more from another facility. They have to have, as part of that federal designation, a 24-hour day, 7-day-a-week emergency department. So these often form the critical infrastructure in our smallest, most rural communities in Arizona. There's 14 right now rural critical access hospitals in Arizona. There's another 2 that are in the process of obtaining federal designation for critical access hospital.
What are the health implications or the health consequences of closures on the communities that they're serving?
So if the critical access hospital closes, often it affects the pharmacy that might be in the area, it might affect the nursing home that's in the area, and any of the other ancillary services, laboratory, x-ray, other types of things that might be available for that. So people are often forced to drive longer distances or go without care.
Now, you mentioned, of course, the way Medicare and Medicaid compensate hospitals, pay hospitals. What are some of the factors that have changed that would lead to a hospital closing?
So Medicaid restoration expansion in Arizona has been the single most important factor in creating positive margins, healthier margins. But even with those changes, if Medicare for quality reasons or other reasons stops paying a rural hospital, often there are days cash on hand that allow them to continue operating despite the fluctuations in billing and collections. If the collections lag too long, they may not have enough days cash on hand to actually keep their doors open and keep paying their personnel.
Are there any steps that you would like to see the state of Arizona taking in order to actually improve or support rural healthcare providers more?
Well, there's probably 2 main things. One is that in health policy, at times you're forced into playing defense. And right now we're trying to sustain and build on the gains made, and there's efforts at the national level to reduce Medicaid funding. Medicaid covers about 2 million of our 7 million population in Arizona. It's critical. I think the second part is we could do a lot to make sure that our services in rural areas are strengthened. And we've done that through some pretty innovative programs in the past. Our Critical Access Hospital Pool, which is kind of our state version of the disproportionate share payments at the federal level. And that combination of DSH payments, the disproportionate share payments from the federal level, which went down as more people were covered, but also the critical access hospital pool that the state has done, those 2 I think could be strengthened. And I guess if I would add a third one, is I think we need to make sure we have the health professionals we need in rural areas. And one of the ways that's very evidence-based is to help train health professionals during their training program in rural areas. And that has a very predictable effect on getting people to practice in those areas when they graduate, either from nurse practitioner programs or dental programs or physician programs, osteopathic or medical training programs.
That's all for this week. Thanks for joining us. To find out what we're working on, visit us on social media and let us know what you think. Lorraine Rivera will be back next week.